Namaste everyone. On behalf of team Talk Evidence at AyurVAID, I welcome all of you to this weekly session. I am extremely honored to introduce a very respected senior Vaidya from AyurVAID Medanta, respected Dr. Bheema Bhatta. Dr. Bheema Bhatta is a gold medalist and MD in Ayurveda from prestigious Gujarat Ayurveda University. Dr. Bheema has over 40 years of clinical experience and is the most experienced Ayurveda physician. He has, to his credit, of treating very eminent personalities, right from former President of India, Prime Minister of India, many ministers, and many well-known personalities. He has been currently an Ayurveda physician and a visiting professor at Japan Yoga Niketan and has been conducting various levels of Ayurveda courses in Japan. Dr. Bheema is very well versed and has a rock solid experience of treating various conditions with his expertise in neurological conditions, musculoskeletal, and various psychological disorders. He has participated greatly over a number of conferences and has won accolades with various awards like Dhanvantri Award, Pranacharya Award, Ayurveda Kulbhushan Award, and also Kannada Rajyotsava Award from Karnataka State Government. Dr. Bheema Bhatta today with his team would be presenting a case on morbid obesity. This is especially a case where the team would be discussing about various interlacing samprapti and pathway of stholya, what we call it in Ayurveda, and breakthrough outcomes for a case through classical Ayurveda approach. Dr. Bheema Bhatta, over to you.
Om Namami Dhanvantarim Adidevam Surasurairvandita Pada Padmam Loke Jararudbhayan Mutyasham Dataramesham Satatam Namami. Good afternoon to everybody. Thank you, Dr. Jankana, for introducing me. Today, I am going to talk about a comprehensive Ayurveda approach in morbid obesity. The heading has been given as breakthrough outcomes rendering whole life transformation in morbid obesity, a comprehensive Ayurveda approach. Now, Stholya Roga has been explained in Ayurveda very well. Stholya is a very complex disease due to abnormal and excessive accumulation of Medo Dhatu in the body fat compared to obesity. So obesity is one of the major lifestyle disorders. Everybody knows about it. Not just a cosmetic concern. It is a medical problem that increases the risk of other diseases and health problems such as cardiovascular diseases, diabetes, hypertension, etc. You all know that 5% of the population in the world, they suffer from obesity. There are various types of medical treatment, lifestyle treatment available. You all know that keto diet, paleo diet, intermittent fasting, gym, yoga, exercise, Ayurveda treatment, allopathy treatment, homeopathy treatment, even the allopathic treatment, liposuction, bariatric surgery, all these things are there, but still without any satisfactory benefit. However, Ayurveda, holistic wellness medical science, the tried and tested medical science, offers a better remedy. In our experience, we have treated, many hundreds of stholya cases. Stholya, atistholya. It may be obesity, it is morbid obesity. all such cases we have treated in our practice. It's important to follow classical Ayurvedic approach, which is not just sustainable but also healthy in the long run without much of side effects. Sthaulya has been described in all textbooks of Ayurveda under Ashtaninditiya Purusha, that is Atisthula, Atikrasha, Aloma, Atiloma. Like this, all these things have been explained in Charaka Sutra Sthana, 21 chapter. It has also been explained as a Santarpanokta Vyadhi in Charaka Sutra, 23rd chapter. It is also one of the Kafaja Nanatmaja Vata Vyadhi, Kafaja Nanatmaja Vyadhi, that is Charaka, Charaka Sutra 20. And also Dushta Medo Roga has been explained in all the medical, in the Ayurvedic texts, there is a Madhavana especially, and the Yoga Ratnakara. You all know very well, BMI, if it is 30 to 35, we categorize it into class 1 obesity. 35 to 40, we categorize into class 2 obesity. Above 40 can be taken as obesity class 3, or it is called morbid obesity, extreme or super obesity we call. Just let us go through, the textual knowledge about, what is this Sthaulya. Very briefly, we can deal with it. Causes of Sthaulya are Vyayama. Vyayamat Diva Swapna Sleshmala Ahara Sevinaha Mudhuro Annarasaha Prayaha Snehan Medo Pravardhate. This has been explained in Madhava Nidana, Yogaratnakara. In all texts it has been explained. Avyayama, lack of exercise. Diva Swapna is a sedentary habits, day sleep. Sleshmala Ahara Sevana, intake of food which increase the kapha dosha, medo dhatu. Other causes include genetic factors. It's a great factor which is responsible for this Sthaulya. Psychological factors are there, depression, stress, and many other things. A lot of medications may also cause Sthaulya. Steroids, antidepressants, so many other things are there. Sthaulya, hypothyroidism, even in the menopausal stage, when the hormone changes, then also people may put on weight, pushing on, osteoarthritis. Some of these things have been explained as causes of Sthaulya. Now, the clinical features, you know very well the clinical features of Ayurveda. In Ayurveda, Shudra Shwasa. I will go back to this one. You can understand that, Shudra Shwasa. Shudra Shwasa, that is a gasping of the air, gasping of the breath. Trisha, excessive thirst. Moha, delirium. Then it is a kind of snoring. Sleep apnea also can be taken in this. Sada, exhaustion. Shut, excessive hunger. Sweda, excessive perspiration. Durgandha. Durgandha is actually a foul body odor. It's Durgandha. Alpa prana, shortness of the breath is there. Alpa maithuna. So these are all the things which have been explained in Ayurveda as the clinical features. Not only that, this is, if at all if the disease increases, it becomes atisthula. In such condition, medo mamsa ativruddhatvat chalasvik udarastanaha. That is a pendulous chest, abdomen, and hips. So these are all the signs and symptoms which I have actually quoted. Abnormal increase in the body fat, abnormal increase in the body weight, excessive appetite, thirst, excessive sweating, excessive sleep, snoring, exhaustion, breathlessness, weakness, foul body odor, pendulous chest, abdomen, and hips. The chikitsa in Ayurveda, Acharya Charaka has prescribed apatarpana chikitsa. because it is a santarpanotha vyadi. In santarpanotha vyadi, apatarpana chikitsa is the main chikitsa which is to be adopted as the main treatment of Saulya. So, in such condition, Vatagnani, Annapanani, Sleshma Medo, Haranicha, Ruksha Ushna, Bastaya Stikshna, Rukshani Udvartanani. So this has been mentioned. That is, in this one actually, Langhana, Pachana, Rukshana, Udvartana, Svedana, Sadhyo Vamana, or Vamana, if we can do it. Virechana, Lekhana Basti, Vyayama, these are all the things which have been told as a Chikitsa Sutra. Now, let us actually come to the case. In August 2021, in our routine OPD, one patient came in a stretcher. Patient was not able to move at all. So, and they told me that, this is a problem. Just one word they told, she is too fat. Can you do something? I told them, let us examine and then, let us come to a conclusion whether we can do something. And they also told me that we have spent a lot of money on this, but there is no result at all. If you are able to take it, and if you are able to give the good result, then only we would like to continue. Otherwise, we don't want actually any other. Because she has been advised to undergo bariatric surgery already, and they were thinking of bariatric surgery. So when she came to my room, and then I told them, I will definitely try my level best, according to Ayurveda. If you follow whatever food I am going to say, if you follow whatever the lifestyle which I am going to say, and we are adopting purely the Ayurvedic treatment, and I'm sure that you will get very good result. With this, I started the treatment, of understanding the patient. This patient information I would like to tell you. Patient UHID is this. Patient name I have not written. It is actually T. She is 45 years old, female, housewife. She is from Uttar Pradesh. Inpatient, we had admitted her in the ward B14549, and date of admission was 21/9/21, and date of discharge was 6/10/21. Total 16 days she was with us. Now you just see her condition. When she came here, see, there are 5-6 people who actually struggled hard to make her sit on she can't sit on any chair, normal chair, she can't sit at all. And it was very difficult for us actually to handle her, from the stretcher to the bed and bed to the stretcher. So difficult actually how to do the treatment in such condition. It was a great challenging case for us. And then patient was brought in the round and cannot change any posture. Her ahara, when we asked about her, what is her usual diet, she says that, mainly the non-vegetarian food, she is taking. The vihara is always, she is, lying down, she can't even, beginning, it is a habit to lie down and then sleep more. Sedentary habits. Appetite was excessive. Bowels were many times irregular. Occasionally constipation also she used to have. Urine was usually normal. Sleep, she used to sleep about 8 to 9 hours in the night time, and also 2 to 3 hours during the daytime. Times, her husband complains that, she sleeps soon after taking the food, and she dozes off, frequently. She snores. Even whenever time permits, she sleeps, and then she sleeps in the sense in lying posture, she goes to sleep, and then she snores a lot. Her mind was totally depressed because nobody likes her. And she has taken so much of treatment, but no result at all. 4-5 people required to shift her from the stretcher to bed and bed to stretcher. Difficult to take her to the treatment room. How to take, this will not be handle the case, also to back to the room. Pradhana Vedana, in her case, abnormally increased body weight since 15 years. In 15 years back, her weight was, when she was 15 years old, her weight was 65 kilos. But then, she got married in the 4 months, means, it was, now it is not 4 months, it was Udara, Nitamba, and Sana, as told, we could see everything, all the symptoms we could see, in her case, and Atisthula, Lakshanas, one can actually appreciate in her case very well. I mean, all the problems, whatever has been explained in Ayurvedic texts, we can see everything, all the signs and symptoms, we could see in her case. The pendulous udara, nitamba, stana, these are all the things which have been explained in Ayurveda. Then we can see it thoroughly in this case. The past history is, in 2019, she had hypertension, and then she took medicine for about 8 to 9 months, and she was following a proper diet and other things, as doctors had told. And then it was not very high at that time. It was only 140 to 150, 80 to 90. It was not very high, but there is a family history of hypertension. She has taken the antihypertensive medicine, and then she stopped taking it because her BP is quite normal. That's why she is not taking any medicine. So she has taken different types of treatment, and has spent a lot of money, but there was no benefit at all. Has been strongly recommended to undergo the bariatric surgery. And family history is actually, both her parents are very, very obese. 4 sisters are there and 3 brothers are there. They are all obese. But this patient is having the maximum weight of 145 kg. To measure her body weight, we used a special weighing machine, because the usual weighing machine, we cannot use it. We have to get from the hospital the goods which they are weighing, such kind of instruments they have, the machine they have. So we have brought those things, actually weighing machine, and we use that one, and we could actually weigh. You can see very well, this is the Athura Patrika. Athura Patrika, whatever I have already told, it has been mentioned in that. And then here we have actually mentioned the history of this one. The history continuation is this one. This was recorded at that time. And then outcome parameters. These outcome parameters are at a time, I am going to tell everything, actually, when she was admitted, and after that, when she was discharged, and also when she came, for a further visit, review, that also I will discuss these things a little later. Attasthana Pariksha, Nadi was actually Shita Nadi, and then, very feeble, we were not able to actually understand, whether the pulse is there, because of the too much of fat, we are not able to actually understand, but still we could actually, it was a very feeble Nadi, and then it was 86 per minute was there, and then Jihva was slightly coated Jihva was there, and then very thick Jihva was there, and this Mutra, so about 5 to 6 times in a day she was going in 24 hours, and it was mostly under control only, it was normal. And but the only thing is, she cannot go on her own. She used to use the diapers, as well as some help she was using. And Mala, only 1 to 2 times she was going for the motion. Bedpan she was using, and she was not able to move. Before June, she was able to actually go to the bathroom. She was able to attend to her all the normal before June 2021. So Shabda, Sadharana Shabda, And then this one, sparsha is actually shita. Sparsha mrudu. The skin was mrudu and not very dry or anything. And then there was some rana shotha. Our lady doctors, examined her, and then they came to know that there is a rana shotha, small boil, blister type of thing was there on the anal perianal region. That was tender also, and there was a pus accumulation was there. Akriti is actually stula, and drik is normal, and Stri Roga, her periods were between 30 to 45 days, and only 1 or 2 days, she was having this one, bleeding. Last period was actually when she came here, it was August, early August, she had this one. Now, Dashavidha Pariksha. In Dashavidha Pariksha, mainly Kapha Prakriti. She's a typical Kapha Prakriti. We can see this one. Whatever has been explained, we can appreciate everything, in her case. Then Vikriti is actually, Roga. Roga Bala is actually Balavan, and the Rogi Bala is very, very Avara. Then Sara is actually Meda Sara, we can say, but actually we should not actually take it as a Sara because it's a Vikriti. That's why when we say Sara, we have to actually talk in terms of the healthy condition. So Samhanana is a Pravara, Samhanana, and also her Pramana is actually Pravara, and Satmya is a Sarva Rasa Satmya, Sarva Rasa Satmya, and Asatmya, she did not say anything about the Asatmya. Then Sattva is very, very Avara Sattva. She doesn't have much of this one. And then Tamoguna Pradhana Prakriti. Tamoguna Pradhana, when we say Prakriti, Daihika Prakriti, we should also say Manasika Prakriti. Her Manasika Prakriti is Tamoguna. Always eating and then doesn't think of anything. She is lying down always. See, this is her Manasika Prakriti also. Then Ahara Shakti is Pavara. Even though she should not take, she knows that she should not take, but she is taking. This is also a kind of Pragnaparada. Vyayama Shakti, totally nil. No Vyayama at all since about 4 or 5 months. She is, that means since August, she doesn't do any exercise. Vaya is Sampurna. Agni, Jataragni is Tikshna. Dhatvagni is Manda. That is Dhatvagni. Which is Dhatvagni? Medo Dhatvagni is Manda. Ama, Dhatvagni Mandejanya Ama. Dhatvagni Mandejanya Ama. The Koshtha, Madhyama Koshtha. We can say that, because of the Jataragni, it is a plural Koshtha, but actual Koshtha is actually Madhyama. Then Atura Desha is a Kapha, and Bhumi Desha is a Sadharana Desha. Kala, when she came to us, it was actually Grishma Rutu. And Roga Avastha is actually, Vyakti and Bheda. Roga Marga, we can say that is a Bhashya Roga Marga, is the skin. And Abhyantara Roga Marga, we can say Bhagandara may be taken as a Abhyantara Roga Marga also. But she has not come here. She did not say anything about, about the Bhagandara at all. But later on, she told that she also has this kind of problem. So we mentioned it. And then Rogi Bala is actually, as I told, Avara, Rogi Bala. And the Rog Bala is Pravara. Agni is a Jataragni, Pravara, and the Dhatvagni, Avara. Like this, we have mentioned everything. And then now, coming to the Rogi Pariksha, and Rogi Pariksha. So, Atisthula is the main thing. Actually, provisional diagnosis is Atisthula, that is a morbid obesity, and Apabahuka, that is the cervical spondylosis she is having. We have confirmed that actually by MRI and also by X-rays, we have confirmed it. And Bhagandara is also fistula and she is having. When we see the samprapti, the ahara, excessive intake of the heavy oily food, overeating, sweets, too much of butter, ghee, and other things. She likes all those things. And too much of milk she was taking. Buffalo milk. She used to take. All these things people have told, but still she is actually doing. Too much of rice and bakery products. They like it. And vihara, sedentary habits, no exercise at all, and she also sleeps in the daytime. And the manasika, slightly, anxiety, stress, and depression, she has. The nidana, avabahuka, and also bhagandara are both nidanarthakara roga from the sthaulya only. And Pura Rupa, she started having a very slight, even when she was a child, 15 years old child, her weight was 65 kilos. Later on, after the marriage, she started putting on weight and then it increased. That is Puru Rupa. That itself shows that, it is actually obesity or sthaulya. And not only that, her parents are also, and her brothers are also, brother sisters also having a, so that Puru Rupa we can very well understand by that. Vishishta is an uncontrolled, Vishishta Puru Rupa, uncontrolled weight gain. And the Rupa, Atisthula, Grivashula, pus and blood discharge, from the pre-anal lesion. Upashaya, Anupashaya, she also says that, she was having pain and then, some painkiller oil she was applying and that was giving relief. Here also, when we were applying some Mahanaranatelam on the neck, she was getting some kind of relief, in the cervical region. Samprapti Ghataka, dosha, kapha mainly, Vata and Pitta are not much, but kapha is the main dosha. And in the mana, tamo dosha, rajas and tamas are the mano dosha, and tamas is the main dosha which is inward. The dhatu are the dushya, rasa, rakta, mamsa, meda, asti. All these the dhatus are involved. Agni, Jataragni, Dhatwagni are mainly, and even Panchamahabhutagni is also involved very much. Panchamahabhutagni, Up Mahabhuta, and also, Prithvi Mahabhuta, Agni are actually not in order. And Ama, Medo Dhatwagni Janya Ama, that is Medo Dhatwagni Ama, Medo Dhatwagni Mandya. Because the Agni in the Medo Dhatu is not actually working well. That's why the Medo Dhatu Agni Mandya Janya Ama. And the Shrotas, Rasavaha Shrotas, Raktavaha Shrotas, Mamsavaha Shrotas, Medavaha Shrotas, and mainly these Shrotas, and because of the accumulation of the fat in the body, the Medo Dhatu is increasing. Further Dhatus are not increasing at all. That is, further Poshana is not actually available because of the Shroto Avarodha in the Medo Dhatu, Medo Shrotas. Further Dhatus are actually not formed properly. That is, Asti, Majja, and the Shukra Dhatu. So we can very well say that Mithya Ahara Vihara, mainly the Kapha, Vardhaka, Kapha Vihara has led to Kapha Vikriti, and then that actually, led to the Rasa, Rakta, Mamsa, Meda, abnormality, and because of that, the sthaulya, the Agni Mandya has taken place in the Medo Dhatu, which has led to increase in the Meda. I have mentioned here Samprapti like this, etiology, Mithya Ahara Vihara that I have already told, which in this Kapha dosha, sweet and unctuous food, also sedentary habit, they are all going to increase the Kapha dosha, Medo. Formation of the movement, formation and movement of the excess Madhura and Snigdha Guna, Ama, in Ama, because Ama Annarasa takes place, and increase in the Snehamsha in the Dhatu especially the Medha that takes place, that is of actually triglyceride, we can say cholesterol. In her case also, I think it is, I will show you the lipid profile test. In her case also it was more. And Vikriti Medo Vruddhi was there, deposition of the fat in adipose tissue, Medo Vahashrota Savarodha, disturbance in the movement of the Vayu, because of the avarodha of the Vayu. The Vayu is actually turning towards the Koshtamarga. When the Vayu increases, Samana Mata Vati Samano Agnisamipasthaha, Koshthe Charati Sarvataha. So when it increases in the Koshtha, what happens actually, our appetite increases. It increases the Agni. When it increases the Jataragni, so the person will be eating more. So faster digestion takes place because of excessive Jataragni. And assimilation also takes place. Appetite, kshuda increases, and also trishna increases actually in this condition. And then excessive eating will be there. Because of the excessive eating, overload on the Medo Dhatwagni, which lead to Medo Dhatwagni Mandya Janya Ama. This Ama production leads to the Sroto Dushti, that is Sangha, and Ati Pravrti. Both take place. And also Medo Vruddhi Roga starts. In this way, so we have. So these are the examination, the lab examination which have been shown here. Yeah. So her PSH was 5.50 and HbA1c was only 5.3. She is not diabetic, and X-ray of the thoracic spine shows that thoracic, upper thoracic and also cervical spondylosis was also there, and then the MRI which was done in August 2021, that shows that central disc protrusion at C5 and C6 causing a severe canal stenosis, compressing the cord with the cord edema. That was also there. We cannot neglect it. She complains of this pain, we cannot neglect, so we have taken care of this also in her condition. Now, Chikitsa Siddhanta is actually Nidana Parivarjana, correction of the Ahara and Vihara. Apatarpana Chikitsa, as I told earlier, Langhana, Rukshana, and also Svedana. Medo Dhatwagni Deepana, Shroto Shodhana, Medohara and Kafahara Chikitsa, oral medication Shamana, and also Panchakarma Chikitsa, that is the Shodhana Chikitsa, we have to do it. And in Chikitsa, we have actually given her some oral medicines, Medohara Gugulu, Trayodashanga Gugulu, mainly for her neck, we have given Medohara Gugulu to reduce this one, Yoga Ratnagara authenticity. And then Rakta Shodhaka, one tablet we have given actually to reduce the abnormality or the toxicity which are there in the blood. The Rakta Shodhaka we have given, so that the Pidaka and other things will not be there. Rakta Dushti will not be there. So for that purpose we have given with the Triphala Kashaya 20 ml and Madhu 10 ml. So Charaka has actually told that Triphala Kashaya and Madhu are very, very important for the treatment of Sthaulya. So we have given as Anupana along with these medicines, and after dinner we have given Vyoshadi Gugulu. Vyosha is actually ginger, shunti. The Vyoshadi Gugulu is also another medicine which can be given for Sthaulya. Mahayogaraj Gugulu for her knee joint pain. Avipatikara Churna, daily some kind of virechana should take place. For that purpose we have given. Panchakarma treatment. In this Panchakarma treatment, we divided. We cannot do all the Panchakarma treatment, at a time. So we made it into phase 1 and phase 2. Phase 1 is actually, Udvartana Nadi Sweda and Churnapinda Sweda we did. All 16 days when she was here with us, actually, we did Udvartana, Nadi Sweda and Churnapinda Sweda. Morning, afternoon and evening, we did Udvartana with the Kolakrutyadi Churna Trifala Churna, Nadi Sweda with the Dashamula and the Shunti Kashaya, and also Churnapinda Sweda with the Kolapul Thadi and Trifala Churna, we have done it. And then Ahara, when she was admitted here, we used to give her very, very light diet, very, very simple diet we were giving. Wheat, dalia, we were giving 1 katori, and also some fruits, were given to her. Sometimes we were giving her oats, sometimes we were giving her in the morning breakfast, we were giving her only 1 piece of bread, atta bread we used to give. In this way, we were giving her breakfast, and very simple, we were giving. She was really very much bored with our food. And she told that, she would like to go away after 7 days. After 7 days, when she says that, I don't like this kind of food, it is not a tasty. But we told her, so you have promised to stay here. We are also, trying our best. You please stay and then continue for 1 more week, at least, we told her. So moong dal soup, we gave in the morning snack. And also in the lunch, we gave 1 roti, dal, katori, and the vegetable we gave. Evening, buttermilk, 1 glass. And in the dinner, we gave vegetable soup and khichdi we gave. Vihara, she can't do her vyayama on her own. We have to do the vyayama, passive exercises we did, and also pranayama. We were telling her to do pranayama. So that was very, very good. Now, outcome parameters, you see her weight. I have mentioned 4 occasions, when we have taken all these things. Her weight, and she was admitted on 21st, we did all the things. She came in the evening, 21st. So 145 kilo it was there. So on 5th of October, when she was discharged on 6th, so 5th, 142 kilo, only 3 kilos was reduced. She was very, very unhappy. She told, I have spent a lot, but you have reduced only 3 kilos. But we told her, don't worry, you continue all these things. We pacified her, and then, so she went home, and on 23rd of December, she came back. Her weight was 134 kilos. Because it was 145, it has reduced to 145. 11 kilos she reduced. So she was very happy. So that's why she came. Otherwise, she would not have come at all. So then the 4th was, it is not, she has not come here. Only video consultation was done. And it was actually 126 kilos. You can very well imagine, from 145 kilo, if she has reduced to 126 kilo by very, very simple Ayurvedic approach. Her height was 146 centimeter. It was so difficult to actually measure her weight, measure her height also. And the 146 is this one. BMI was 68.07 at the time of admission. You see the BMI, when she got discharged, it was 66.67. And then after, in December, she came, her BMI was 62.9. And then BMI now is 59.15. Encouraging results are there. Waist circumference. So you all know that, waist circumference should not be more than 40 inches for a normal person. You see here, 63 inches and 61 inches, when she got discharged. At least 2 centimeters, 2 inches, it was reduced. And then 60 inches. And then 57 inches recently, in January 20th. That is about 1 week back. Hip circumference. Hip circumference is 60 inches. And this second time it was 58. It became 55, 54. Waist and hip ratio in gents, it should not be more than 1. And in ladies, it should not be more than 0.8. But in her case, it was 1.05. But it remained because, weight is also, this one, waist circumference and hip circumferences are reducing. So, but it remained, waist and hip circumferences remained the same. Mid-arm circumference in the right and left, we have measured 18.2. And it came down to 17.5, after about 3 months of treatment. So in this way, we can see mid-thigh circumference. We have taken 25 was there in all the, in both the thigh. And on 5th of October, it was 24.5. Only 0.5 inches was reduced in the circumferences in both. And then in December 24, and now in January, it is 23. Chest circumference was actually 57 centimeter. Sorry, this is the inch actually. 56.5 inches and 56.5 and 54 inches actually, in this one. So neck pain was actually 7 out of 10 when she was admitted. So she was having, this prolapse of the intervertebral disc, C4, C5 and C6. And because of the continuous lying down and not able to do any movement, that problem, probably that problem has started. And it came down to 4. And then, when we did the further treatment now, it is very much under control. It is only 1. Neck stiffness was very high earlier. Neck stiffness, it was medium. And then neck stiffness became low. Shoulder joint pain, in the out of scale, 1 to 10, 3 was in the right, and the left also 3 was there. But it became, normal, and she was not having much pain. She was able to actually lift her shoulders. Knee joint pain, earlier it was there, in the right it was 3, it came down to 0, and left it was actually 6. Earlier it came down to 2 now. And the state of mind was very, very poor. We had to encourage her. We had to actually sit with her and then, talk with her. Counseling is to be done properly. Then only she improved. Now her mind is very good because she has reduced 19 kilos weight. And breathlessness, on exertion. Even when we are lifting her, when we are doing she doesn't do any exertion on her own at all. We are actually taking her to the bed, to the treatment room. That kind of exertion itself was, breathlessness was there. Now the breathlessness has reduced very well. Now the total cholesterol was 221. Now it has come down to 198. Triglyceride 166, 153 now. HDL cholesterol 34 and 35. LDL cholesterol 132, 126. TSH was, this one normal, and the HbA1c is also normal, 5.1. And the patient outcome, this patient, they can't write properly, but they only have written. But my suggestion is actually they may not be able to write. Those who are not able to write, we have to write it. But anyway, they have written, and they are satisfied with this one. Now you see here, so this was the earlier one. Once again, there are 6 now. After the treatment, you see here, now she is coming walking, and this particular walker is a special walker because it is not a normal walker, because she can't fit into normal walker at all. She can't actually fit into any wheelchair at all. This wheelchair which they have brought is actually a separate, a special wheelchair. The wider one they have brought. So in this way, see, she looks round. She doesn't actually look like a human normal body structure. This is her. So I have given you a very, very brief idea about what we have done, and our treatment is not still over. We have advised her actually to come back as early as possible to take further treatment. Our further treatment will be actually Virechana, Vamana, and also slight Virechana and Basti, Lekhana Basti, this one Udvartana. All these things we are going to do. We have planned for about another 3 weeks treatment. We don't know when she is going to come, but she will come. And Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, mahakaschit dukkha bhagavave. So thank you very much.
Thank you very much, Dr. Bhatt.
Dr. Bheema.
Yeah.
Yes.
We open the forum for the
Most impressive outcomes. Thank you very much, and compliments to you and the entire team. With your permission, as I mentioned earlier, I'll take leave because I have to join this other thing. But I will look for, hear the rest of the recording later. Thank you very much.
Thank you, sir. Thank you very much.
Congratulations, Dr. Bheema and team, for this wonderful outcome. I have a question. While we talk about obesity, scholium, and specifically in this case, where it was morbid obesity, and you can see that the patient was already with a fat which was visible. So from the outcome that you achieved and from the assessment that you did, were you able to figure out and find out the difference that the treatment Ayurveda approach had, not just on her subcutaneous fat, but also on her visceral fat? So she being such morbidly obese, definitely the two categories of fat that you would have observed. So what are your views from an Ayurveda perspective on visceral fat versus subcutaneous fat?
Yeah. Actually, in Ayurveda, it has been told that Medo Mamsa Ativruddhatvat Chalasphik Udara. So in Udara, especially, it has got probably a lot of loose space is there. So there, where the fat can accumulate, wherever the fat can accumulate more, that is a place where it accumulates. That is visceral fat actually, and the all over the body also she is having fat. So we can very well understand by the measurement which we have taken, the waist measurement, and also this one, we can very well say that. So probably the Dhatwagni, Vapa Vahana, what has been told in Ayurveda, Vapa Vahana. In Vapa Vahana, it is accumulated much more than any other part of the body, according to Ayurveda, what I say.
Got it, Dr. Bheema. Also, connecting point to that was that although she being so obese, if you look at her metabolic parameters like HbA1c was well under control. So somewhere that also gives an insight, probably, that there was inherent metabolism which was favorable, but there were obstructions which were not allowing her to achieve it fully. Probably that was protecting her. Otherwise, we typically see that obesity, sedentary lifestyle, options which were not allowing her to achieve it fully. Probably that was protecting her. Otherwise, we typically see that obesity, sedentary lifestyle.
Yeah, I understand. The measurement of the fat, outside fat, can also be gauged, by a particular this one, a meter, which we are not using in our hospital. Even when we contacted our hospital people, the visceral fat, how to make the visceral fat, how to measure it, So, but they were actually making a small calipers. They were using a calipers, but even in endocrinology department, they don't use actually this kind of calipers. They have it. They have it. For outside, they actually put it and then see what is the fat content, fat. So all our body fat, can very well measure it actually, but internally they will not be able to do it. According to our Ayurvedic, this one, we can say that Jataragni is very good. That's why she is eating so much. So all these things are going and converting it into Medo Dhatu, because there is a Medo Dhatu, Agni Bandya. So because of that particular Dhatwagni Bandya, the Shroto Avarodha has taken place. The further dhatus are not being prepared, and then accumulation, abnormal accumulation. Abnormal in the, of course, we have seen patients even about 190 kilos also. But this patient is actually out of about 14 patients which we have seen in 1 year, obesity patients. 4 were morbid obesity patients, and this was the maximum one. And so what I feel is, according to Ayurveda, we can understand that Dhattvagni Mantya is the main cause of this particular Sthaulya.
Thank you, Dr.
Good afternoon, sir.
Good afternoon.
Congratulations, you and the team, to get a good results. Sir, I have a question. From a morbid obese is considered as a hormonal disturbances, especially serum cortisol.
Yes.
Serum cortisol differentiation is one of the factors, along with other hormones.
Correct.
Was serum cortisol tested for this patient?
No, we did not actually test. Actually, that is actually costly treatment, this one, and they don't actually do it here. And we have to send it to the different lab, and that was actually 45,000 rupees. They told, and they are not able to spend so much at all. So
Serum cortisol.
Serum cortisol.
No, it's 1,000 rupees. It's 1,000 rupees test.
No, here, serum cortisol, there are 2 things. The test we have not done. We will take it, next time when she comes here. So we will take this particular suggestion, and we will do cortisol test also. We wanted to do in other cases also.
Yeah. What would be the cause for the morbid obese? As per the endocrinologist, what would be the reason? Because we can say as a metabolic causes from our side, but from their side, what is the diagnosis, the reason it could be?
Morbid obesity, they always say that it is a metabolic disorder. It is not only, and not only that, it may be connected to the hormone, it may be connected to the genetic factor also. Genes are actually, all people in her house are actually obese, but nobody is having, diabetes, and nobody is having a, very high level of any hormone changes. So what we have to do is actually, we can just say that it is actually, ati sthula. According to Ayurveda, if we do the treatment, probably, we have achieved, something about 19 kilos, she has reduced, which she never thought that she is going to reduce. And we thought that, she may further, if we do the treatment, Shodhana Chikitsa, proper Shodhana Chikitsa, we have not yet done. We have done only Udvartana and also Bhashmasveda and also this very simple dietic correction and other things we have done. If at all we do properly further Shodhana Chikitsa, probably we will be able to achieve. And at that time, we are thinking of actually, doing other tests and involving our endocrinologists also in this.
Sir, at this point, I would want to add Dr. Zankana's madam's also one added question. If you say a weight, say X number of weight, it includes fat plus fat-free mass, or what you call as a fat lean mass, which means it is a combination of your fat plus water content plus your ligaments, tendons, bones, muscles, and your visceral organs weight. So that plus this together is considered as a weight, which combines with your BMI, which is also a BMI part. Now, if we do something like, we have seen researchers that, when you do a crash diet or when you do something called a keto diet and things like that, your weight number will reduce. It's not the fat which is burning down, it's a fat-free mass which is burning down. In this case, is it the fat which has come down or the fat-free mass which has come down, sir?
No, all together actually. We can't say that it is only because we cannot understand whether only the fat has reduced or other things in the body also has reduced. That those things we may not be able to actually, we will not be able to say that. But overall, her weight has reduced. So now we have to see, there is one particular machine, that here they are using the calipers. Next time, we are going to get that calipers and we are going to measure the fat. In every part of the body, we can actually measure the fat. What is the fat?
Body fat analysis. It's called body fat analysis.
Yes.
Body composition analysis, BCA.
Yes. Yes, yes, but that we are going to do it. She went away, abruptly. She was ready to stay here only for 1 week, but we convinced her and then made her to stay here for 2 weeks. But she went away. But we
Okay.
wanted to do so many other things also, and to handle
Right.
her, it was so difficult for us.
Yeah, understand. Thank you, sir. Thank you.
Congratulations, Medanta team, and especially Dr. Bhatta for this excellent outcome that you had gained. And I feel that since an thyroid THS was she under any thyroid medication?
She was not
Thyroid.
on any, because her thyroid level was always normal, and there is no past history of hypothyroidism at all.
Yes. So when we see that part, her thyroid was normal and her periods were also within the normal range. So I think it was more of the metabolic correction that was needed to address her obesity. And along with that, of course, a genetic factor would have been there. And I think at least when the Rukshana therapy was done, we could get this outcome. So as you said, if we move forward with the Shodhana therapy, we would be able to get more interesting result in such cases, I think.
I think so. I think so. Because, that's why, we had told her in the beginning itself, we are going to give you only this much of diet. You are going to do this one, this one, this one, then only you get admitted. Otherwise, don't blame us later on. We have to tell the patient, so she was not ready to get admitted at all. But somehow or the other, she was convinced, and then, she got, and then we gave her, I told you the diet, what we gave.
Yes.
So, and now also she should actually take the same thing. We believe that she is taking the same kind of diet because, she has reduced further weight. So we think that, she is following. So this is only purely a metabolic disorder, an abnormal metabolic disorder. May not be connected with the thyroid, may not be connected with the cortisol, which we are, of course, going to do it later on also, any other hormone. We have to actually, so we are trying our best to the endocrinologist in this case, and then see what they are going to suggest, what they are going to say. People are actually keto diet and other things, people are actually following. They write that you give 5,000 rupees, we will reduce 4 kilos weight. We should actually, AyurVAID people should say that, you see here, in 3-4 months time, she has reduced about 19 kilos weight. So
even for
Ayurveda,
bariatrics, this
that's why
correction
Ayurveda, classical approach of Ayurveda is really a very, very effective, not only in a Sthaulya case, but in every case. Sankhepatah kriya yoga nidana parivarjanam. First of all, nidana should be understood. Nidana mado pariksheta tadunantaram. Nidana properly, if you understood. So then I came to know that it is only a metabolic disorder and nothing else. So then it was easy for us actually to handle, and then we got the result.
So in the next step, would you plan for a snehana or something? Snehapana?
Yeah, we are actually, yeah, we have to do this one, Snehapana and Vamana. We are planning actually, she should agree for that actually. She has to drink and then she has to vomit. Sadhyo Vamana, we are actually planning initially. And then, we are actually planning the classical Vamana, Vamana Karma. And Basti Karma, Lekhana Basti, we are going to do it for a long time.
Is she from nearby Medanda or she stays far?
She is from Uttar Pradesh. Uttar Pradesh. She is not from Delhi. Otherwise, she would have come, every week we would have called her.
Yes.
She can't come. That is
she needs connected.
Yeah. But she is so much satisfied. She is definitely going to come back to us.
So at least we could gain her confidence.
Yes. Yeah.
So
That's
thank
why
you.
Aturasya Antaratmanam Pravishya. Thank you.
Thank you.
Thank you, Dr. Bheema. Thank you. We look forward for further more discussions on this subject and
Yes.
receive your guidance.
Yeah, thank you very much. And then I thank my colleagues, Dr. Aswati, Dr. Rahul, and all my CGs. I'm really very, very thankful to them for their support for carrying out this Panchakarma treatment in her case. Thank you. Thanks to all of you.
Thank you, everyone. Thank you, sir.